So this is a question that has been asked by one of my patients. The person says, I am 70 years old and have been experiencing increasing difficulty with memory over the past 2-3 years. I have also been managing type 2 diabetes and hypertension for the past 10 years. What steps can I take to improve my memory and overall cognitive health? Can early stages of Alzheimer's disease be reversed through yoga? No, so person is really worried about more severe consequences and has been experiencing memory loss. I would like to first ask my students to share the views and then we will go to the experts in the meeting. Okay, Vibha, what do you want to say?
As Tarana said, Alzheimer's can't be reversed from yoga, but we can educate the patient. As age progresses, the cognitive decline is common and help him with certain techniques to avoid the progression of decline in a very abrupt manner. We can teach him slow Kapalbhati, Trataka, and some mantra chanting techniques. And also, he has comorbidities like hypertension and diabetes, which are risk factors for cognitive decline. So we can help him in treating those conditions.
Very good answer, Vibha. Very good answer.
Yeah. Good morning, sir. This is
Yes,
Surya.
yes,
So, yeah, sir, I, to keep the memory powerful or, constant, because my parents themselves are senior citizens, like 75, and my dad is 87 years old. But both of them are very active in reading newspapers, and my mother always solves Sudoku puzzles, crosswords, and she plays patience. So people in her age group are having failing memory, but my parents aren't. So I guess this habit of reading and keeping the brain active. She solves Marathi crosswords and I taught her to do Sudoku. Now she beats me at Sudoku. So I guess her memory has become sharp. So I think playing patience, she's a retired teacher, but a teacher can never give up. So
yeah.
she always has to keep her things active. And even though she's 75, she keeps saying, if you know any students, please. So she can brush up on her French language, keep her brain active. She's not suffering from anything, but I guess this has helped her. I mean, over the years. So I don't know whether this person likes to do crosswords, Sudoku, because these are the kind of things which keep your brain sticking. You have these in the paper called jumbly, scrambly, make a word with these alphabets. So then you keep thinking, and then that keeps your cognitive power and your brain memory very active. And then to read. And then sometimes I ask my mother, I said, Mommy, what did you read interesting in the paper? So then I know that the information has sunk in, like, uh, or when we come back from a movie, I ask her, because she has a habit. If you go in the theater and the AC is on, she sleeps, she gets that little bit thing. And then we know, that maybe these are these subtle signs. She's not got anything, but sometimes mommy forgets things. So we keep on asking her these things. Mommy, is this okay? Is this all right? So I don't know, but with this person having diabetes and hypertension, because my parents don't suffer from either. So I guess they are better off, but you could suggest, I don't know, for this person. Thank you, sir.
Thank you, Surya. These are very, very useful suggestions, simple exercises for the brain. And as you very correctly said, the more the family is involved, the more you involve them into activities and not isolate them, the more they are protected. So social isolation, depression is actually a risk factor, uh, towards the Alzheimer's and dementias. People who are more socially active, more connected, family gives them value, such people have, these are protective factors. Madam has written in the chat box, altruistic activities, involvement with people to keep the mind sharp, regular physical exercise, deep breathing, anulom vilom. Not focusing on memory loss helps. Use aids like phone reminders instead of worrying about something that is. So definitely you can use technology. You can put reminders in the phone. Beautiful. And also the vitamins like B12, iron, D3 should also be corrected, and that vitamin deficiency also can lead to this kind of problem. Other medical condition like hypothyroidism also leads to memory related issues, so other causes should be corrected. Thank you, Anju madam. Raghunath ji, you want to share?
Morning, sir.
Yes,
Good
yes,
morning, sir. I am Raghunath here. Of
yeah.
course, I am 89 today, and I go through some of these problems of course, I don't have forgetfulness as it is, but I may come across sometime. So my often thing, I always go for some chanting, or I try to talk to people. I read the newspapers and
Yes.
talk to people on some of these subjects. When I discuss with them, I try to talk to them about the matter what I've discussed. That will actually bring me back to my memory.
Yeah.
And otherwise, I always keep reading some of these books and all that, and try to memorize and try to put it on WhatsApp to others. So that has kept me actually active. And even at my age today, I proud to say that I don't have forgetfulness.
Wonderful, wonderful, Raghunath ji. It has been 5 years. You have not missed a single session of yoga. So that way you are doing, a wonderful, wonderful thing. It is a great inspiration for all the people who are here in the meeting, to see you so healthy. Please keep it up, sir. Please keep it up. Wonderful. Okay, anybody else would like to share their views on how to improve memory as you age? Sukumar ji, yes.
Yes, sir.
Oh, sorry. Sorry, Sukumar ji, please unmute yourself.
Yes, sir. Sorry.
Yeah.
Good morning, sir. I worked in neurology field 10 years,
Yeah.
psychiatry field. And my work is, I'm a clinical neuropsychologist to assess the memory of dementia, Alzheimer's disease.
Yes.
It is, first, there's no awareness in the society. There are different type of Alzheimer's disease. Some things behavioral memory issues. People are not aware about it. They're confusing with normal memory issues. Everyone have a decline after 40 years, but this is different. This is pathology, something problem in the neurons. They should understand. And there's no proper treatment for it. Till now, research is going on, but supportive therapy, it is treatable, not curable. That should they understood. And yoga, some memory training, neuro rehabilitation, improve the memory, attention memory. The rehabilitations will help supportive, and it depends on the stages, what stage they are coming. And usually preventive is better than cure. And there should be a physical activity 1 hour every day, or any activity, swimming or yoga or something, cardio activity. They have to continue for a long time. That people are really. Then depression is the main reason. The research shows that the people are dysthymia, long depression, chronic depression, not treated properly. They are going to have Alzheimer. There's a prone to that. Alcoholism, smoking, drugs abuse. So these should be give awareness. That is the main thing.
Yes.
And once it comes, and I come to know 5 to 7 years, 5 years, they will their duration of their lifespan depends on previous their premorbid personality and activities. So since childhood, it's like a wealth we have to save slowly. Since childhood, how much they are active and all, that particular weapon will come out bounce back very. Resilience is more. That is my understanding. But if you do yoga since childhood or any activities, you will overcome. If even it come genetically, you can bounce back very quick.
Thank you, Sukumar ji. Wonderful advices. As you very correctly said, that the role of yoga here, we cannot say that once the disease is set in, yoga can reverse it, but definitely yoga can help prevent the risk factors, from coming up. It is known as primordial prevention. So we have to understand that the normal aging, and the aspect related to Alzheimer, first we should be able to differentiate that. Many people get confused, whether I am aging or I have developed some serious illness. So generally, in usual aging, when you have memory loss, you may be forgetting some names or appointments, but you may remember them later. But whereas in early stage dementia or Alzheimer, what happens is you forget recent event conversations, or you may keep asking the same questions repeatedly. Very recent event has happened and one forgets that is something that you observe. Similarly, keeping things at unusual places, like you keep your specs in the fridge. Generally people don't do that. So these are some aspects related to their visual memory, where I kept things, those they start messing. If it is moving toward dementia, in problem solving ability, you see that people may take longer to make decisions or solve problems in usual aging. But in early stages of dementia, you observe that the step by step instruction, even if it is given, the person is not able to follow. Like very simple thing, like I tell that, okay, hold this paper, fold it 2 times and keep it on the ground. Now this is a very simple. There are 3 steps. First, you have to pick up the paper, you have to fold it 2 times, and then keep it on the ground. The person may not be able to follow those steps if it is a problematic situation. Similarly, related to language issues, conversation, you are talking and suddenly you just become blank, you just lose the whole conversation. Then probably it may be more severe, but you not being able to recollect 1 or 2 words, it is not a problem. It may be related to just usual aging process. Disorientation is another very important point, where I momentarily forget the day of the week but recall it later, that's fine. But then getting lost in familiar places, or not feeling oriented to whether it is morning or afternoon or evening or night, these indicate the problem of more severe disease. Then the judgment, noticeable poor judgment, like giving away large sums of money to scammers, or not being able to properly manage transactions related to shopping or doing things which previously person used to do it easily. That kind of thing is also important. If there is a sudden worsening, like previously what person was able to do a year ago, he is not at all able to do now, then also you may be worried. Then mood and personality, mild mood swings, little bit of stubbornness comes with aging. People stubbornness and expressing the emotions is normal. One may not be able to hold back the emotions as one ages, as he used to do it before. But here what happens is there can be major mood swings, there can be a significant change in the personality. Person may not be able to hold himself, especially in the frontotemporal dementias, there is a drastic change in personality, where person starts behaving or doing such activities in the society which usually people do not do. It starts becoming more and more awkward inside the society. The disinhibition increases. Sometimes there is an aspect of suspicion, doubt, those kind of things start coming up, because people are losing their things, they are forgetting. They start slowly developing a delusion that I'm not losing things, somebody is stealing it. And they may start doubting their family members. These are the aspects which indicate a more severe aspect which you should be worried about, and you should consult an expert. Then, as everybody told, there are risk factors which can be avoided. So here comes unhealthy diet, substance use, diabetes, hypertension, depression. It is to depression, and depression to dementia. That is a kind of a curve that is happening. Obesity leads to all other problems: hypertension, dyslipidemia, even diabetes, then depression. Everything is connected to obesity. So we should be very careful about managing our diet. As Sukumarji was telling us, that people who are socially isolated, who are depressed, they are also more prone and have a risk factor of developing dementia. Now, as there are risk factors, there are protective factors also. Like, if you have, the more educated you are, the more protected you are. Secondly, people who have a regular habit of doing physical activity, do 10,000 steps per day, is a very good thing to do. People who regularly engage themselves in some kind of cognitive, like people were telling, reading newspaper, reading, solving Sudoku, puzzles, or engaging themselves in social activities, organizing various events, participating in social gatherings, they also have higher brain and cognitive reserve, and they are also protected. And of course, there are genetic factors. So how does yoga and Ayurveda lifestyle, help here? So important to understand that the uniqueness of traditional systems of medicine is their ability to understand the individual based on his unique personalized constitution. So air plus space make vata. This vata is something which plays a very important role in dementias. Fire plus water make pitta. So vata and pitta are the two characteristics which I think vata leads to Alzheimer's dementia and pitta leads to vascular dementias. Kapha is something that needs to be preserved. So what is a kapha personality? A person who has more kapha in him, you see that he has a tendency to put on weight, but this person will be very stable, very calm, slow in speaking, slow in talking, has good appetite. If he eats without control very quickly, such a person can put on weight. Person has a soothing voice, thick hair. Similarly, a pitta person, maybe a little aggressive, has a very sharp characteristic of, maintaining memory, sharp memory, and very dynamic in nature, and can be very good leader, very dynamic leader. They have tendency towards graying of hair. They have tendency towards inflammation, oily skin. Pitta people also have heat intolerance. They sweat a lot, but they are otherwise well built and muscular. Vata people are thin built. No matter how much they eat, they do not put on weight. No, and they are fast in their activity. They walk fast, they eat fast, they take fast decisions. There may be some amount of impulsivity in the personality type. It is the neuroticism, that goes with Vata. And we also observe, that Vata people have tendency towards developing dryness, and the bones also, have a tendency to lose and become more brittle. Hair also become dry and brittle. Now, Ayurveda, recommends certain dinacharya. Most important among them is sleeping early. Within a few hours after sunset, you should be able to have your dinner, and then within an hour of having 1.5 hour of having dinner, you should sleep. So ideally, sleeping before 9:30 p.m., waking up at Brahma Muhurta, that is 2 muhurta before the sunrise. One muhurta is 46 minutes. No, so uh, so you get up around 90 minutes before the sunrise. That is the Brahma Muhurta, and performing certain rituals, lighting a lamp, doing Vedic chants or mantra chants, or whichever mantra that you do, it's japa in the Brahma Muhurta is a very beautiful practice recommended in Dincharya. Usha Pana is drinking warm water as much as you can in the morning. It also prevents constipation, which is seen when Vata increases. Then nasal oil instillation. Oil is anti-Vata, So therefore, people used to recommend that you put till oil into both the nostril, 4 drops in each nostril, either till oil or almond oil. That was recommended. Lukewarm, you just make it little lukewarm, put 4 drops in each nostril in the morning. Put the same oil on the top of your head, give a gentle massage your palm, feet, sole of the feet, and put 5 drops in the navel region. Do this 2 times a day, morning when you get up and evening when you just before you go to sleep. Then after oil installation, oil massage, then you do exercise, go for a walk or perform yoga. Also, diet becomes a very, very important aspect where you start taking more sattvic diet, more salads, more moong dal, more fresh vegetables, seasonal fruits. They become the major part of your diet. Ritucharya again becomes very important because these are the changing seasons. If you do not adopt your lifestyle to changing season, then the withering away of the body and the brain and the memory becomes faster. So now currently the summer season has come. So mild vata increase is happening. It is a Ritu Sandhya where Sandhi, where two ritus are meeting. The Vasant Ritu is going and the Grishma Ritu is coming. So it is the time where you should be careful. A lot of people are experiencing cold, cough, sinusitis. It is because of this increase in the Vata. So those who have removed, the Vata from their system by performing Panchakarma procedure, in the month of Feb, these are the people who get protected. So spring season particularly is recommended in Ayurveda for doing the Panchakarma. So yearly once doing a Panchakarma procedure is like servicing your body, like you service your vehicle once a year, you should do servicing to your body also. So basti or medicated oil enema is recommended to remove vata. That kind of panchakarma procedure should be useful. What happens with age? As a person, vata is something which may be unique to a personality, but with age also there is a change in that. A very chubby, child, you see all that chubbiness is because of the kapha. Whereas as you reach the middle age, you observe you have become more muscular, you have become more dynamic, more aggressive, and that fire is from the pitta. But as the person ages, everything starts withering away, and that withering away and slowing down and dryness and all those kind of symptoms that we see, perimenopausal symptoms and memory loss, is because of the vata. In fact, in Alzheimer disease, as the disease progresses, you observe gradual thinning of the gray matter and the hippocampus of the brain. So a thick gray matter, which is a kapha brain, slowly becomes a pitta brain, and then later you see lot of empty spaces inside the scan. This empty space is nothing but air, no large ventricles, thinned out gray matter, more airy. The scan becomes more airy, which means that the vata is increasing. So the question then comes is how to reduce this vata. Yoga can be a very useful, yoga and meditation can be very useful vata reducing strategy. In fact, this study has shown that people who had been practicing yoga regularly, 1 to 3 years of regular practice of yoga, these were the people who showed a lesser decline of the gray matter in the brain as compared to controls who showed a more steep decline in the brain regions. Long-term studies actually have shown that yoga practice can increase the gray matter volume in the brain, including those in insula and hippocampus. It can activate your prefrontal cortices, which enhance your decision making and functional connectivity in the brain. So it is beyond doubt, that those who adopt a yoga-based lifestyle, they are protected against these kind of problem. Yoga is one of the protective factor. The study that we did it at Nimhans, where in 6 months in old age homes, we observed that people, when they gathered together and perform yoga 5 days a week together, there was an increase in the size of the hippocampus of the brain. At the age of 90 also, I have myself seen Dr. B.K. Sayangar perform a Shirshasana without any kind of support. There is another person below, who is also maintaining a particular posture, and probably he will maintain it longer than BK Iyengar. Yoga means alignment of the body, breath, and the mind together. If that is not happening, no matter how long you maintain a posture, it will not give you any benefit. Together in gym also and do various exercises, but you don't feel that connectedness. You feel that only with yoga. Why does that happen? That happens because in yoga, you move your body together, your awareness goes together, you breathe together, you chant together, and unknowingly person feels a sense of connect and support. That, I think, is very, very important in preventing this condition. And as I told you, that yoga actually can help prevent other risk factors. So earlier the yoga becomes a part of your lifestyle, the better it is, And what kind of yoga would, such a person perform? Especially, I would recommend using wall support, using table support, chair support, performing a set of asanas. You have to be very careful that you do not fall. Yoga improves balance, but then one has to be careful that while doing yoga, one should not injure oneself, because brain injury is also a risk factor for developing these kind of problems. So always perform yoga beside a wall, use support, have a trained yoga therapist taking the session who knows how to handle the elderly people. Join a group session rather than performing it alone. Ghrita Neti is another beautiful practice where you pour water from one nostril and it comes out from another. It is normal Neti. If you add cow's ghee into it in lukewarm water, or you can also include til oil into it, then it becomes a oil Neti or Ghrita Neti. Once a week, this practice also reduces vata in the head and the face region. Then, of course, pranayama. People were saying about Brahmari pranayama, Nadi Shuddhi pranayama, slow Kapalabhati pranayama. They are all wonderful practices, have been shown to improve decision making, improve psychomotor abilities, attention, and processing speed. Different aspect of cognition, executive function become better by these pranayamas. And mantra chanting. So, Om can be a very simple mantra to regularly chant. We are aware of the Sanskrit effect. You know, people have shown that children who had learnt Vedic mantras and had been chanting had a thicker gray matter as compared to children who did not. So, from early age itself, you know, mantra chanting should become a part of lifestyle, and every day we should spend at least 5 minutes chanting different kind of mantras. It can belong to any religion, you know, follow any hymn, but you chant and feel the vibration of that in your body and brain. Trataka can be another very useful practice where in the evening in a dark room where the the candle doesn't flicker, just keep it at 1 meter distance. Gaze at it without blinking the eyes. Do it for 15 to 20 minutes till tears roll down your eyes. This practice, researchers have shown to enhance cognition, especially in elderly. And then at the end, relaxation techniques also play a very important role. So these are some useful yoga practices